We got to turn our sound on here, just a minute. I'd like to call to order the meeting of the Pleasant Grove City Council work session on this Tuesday, June the 4th, 2019. And we welcome all of our council members who are all here this evening, and most of our staff, and those who have joined us this evening for our work session. We'd like to start this evening with we're moving item number 1 on our work session to our presentations in our regular council meeting, and we'll now, city manager will address us on item number 2 on our CTC program, Communities That Care.
So we've been approached by Heather Lewis with Utah County. She's part of the Utah County Department of Drug and Alcohol Prevention and Treatment. They have a program called Communities That Care that help try to solve some of the social ills that we have before they get to a point where we really have to deal with it and spend a lot of money on it. So I'm going to have Heather kind of explain what the program is and what it means, and then we'll talk about potentially what it would mean for Pleasant Grove to be a part of this. Heather's also met with Tamara Oborn, and I can't remember who else is with Tamara that is working on
Danny Rowan.
Danny Rowan. They're part of a group called Be Well PG. Their focus is more suicide prevention, but they've been connected with Heather, and we think there might be some synergies here to help do something. So with that, I'm going to turn it over to Heather and let her explain what this is.
Welcome, Heather.
Thank you. Thanks for having me. My name is Heather Lewis. This is Melise Warner, and we both work for the county. She's the expert on CTC, so we
Hi,
both.
Heather, really quick before you start, is your mic turned on?
It's
okay.
got the. No, I don't. I'll get closer.
Because I got some feedback after the last meeting that we just make sure our mics are on, that we're speaking into the mic, even the presenter, because it was kind of, they heard some people, not the others, so.
It's like we've heard that before.
Okay, perfect. Okay, awesome.
I can be really loud. I promise.
You know what? That's actually good, like right there.
Okay.
Yeah.
Okay, so I'm Heather Lewis. This is Melise Warner. We both work for Utah County for the Department of Drug and Alcohol Prevention and Treatment. Melise is very well trained in CTC implementation, and so I brought her to kind of talk to you about what CTC is. If you have any technical questions about how it needs to be implemented, she can answer all of those for you. It was really interesting the way that we came about to be here. We actually met with Representative Hawkins at the Senate building. We were there to talk about policy and how we advocate for prevention policies. And he said, oh my gosh, Pleasant Grove is doing this great thing called Be Well Pleasant Grove, and I think that you should connect. And so we did, and it seems to me like it's a perfect fit. What Be Well Pleasant Grove is trying to do is find ways and resources and, different ways basically to support Pleasant Grove in the things that the youth are facing, whether it's substance use, addiction, suicide, depressive symptoms, violence. Any of these things are topics that they would be willing to address in the Be Well group, and these are things that Communities That Care also work synergistically to tackle. And so it just really is an awesome fit. I don't know how many of you saw the email that Tamara wrote, but she said, it's kind of scary to think about giving up control of our Be Well program, but basically for the greater good, she would be willing to do it. And my thoughts were, I don't see it as Pleasant Grove or Tamara or anyone giving up the coalition. I see it as a partnership that will really, really strengthen and support what's already happening. The county, we were luckily able to receive some grant funding that would allow us to support funding, especially for the first year. And we can talk about that more later, but we're just in a really good place to help support. The framework for CTC is so well laid out that you can't mess it up. I mean, if you follow the rules, you follow what you're supposed to do, it works and the outcomes are there. So I'm gonna let Melise talk to you a little bit more about what CTC is, and we'll go from there.
Perfect. I'm just gonna, if you will, So I wanted to just bring just a quick homemade brochure. Please don't judge me too harshly community health is my background, not marketing and design. I try really hard. But I wanted to talk a little bit about what specifically Communities That Care is and what it does and how it's used in other communities. So very first off, it is a process, not necessarily a program. So people often get that confused. People will say, we don't want to implement the CTC program, but we do want to, work with our community members to do something great to start helping our youth, right? So this Communities That Care is really a process to help communities gather together and implement specific things to help protect their kids. On the very first page, it talks about why CTC, and then it has these two fancy arrows. So I wanted to talk a little bit about risk and protective factors. So it's a little bit of prevention terminology that I wanted to share. But oftentimes we talk about, for example, youth substance use or youth suicide, and oftentimes we get really, really caught up in those big, heavy things. Not that they're not terrible, and we don't, we do definitely want to address them. But what CTC does is look at the underlying issues of what's actually going on with that child. So instead of looking at, why a child is choosing to drink alcohol underage, we're going to look at what might be happening in that kid's life to try and reduce that or decrease that completely. So it's kind of the iceberg mentality, right? You see what's going on, the tip of the iceberg, but really there's a whole bunch of stuff underneath the water, and that's what CTC works to address, is that underlying stuff. So oftentimes communities that go through this process often find specific things not even related to youth substance use or youth depression. It's more about maybe strengthening our family units that are in our communities. Maybe it's about working with schools to help kids feel like they're more connected to their schools or that their coursework is more relevant to them. So specific things like that. So going up ahead of the stream before kids actually get involved in some of these problem behaviors that we're worried about. That's what CTC works to address. It has 5 phases that communities will go through, and it might seem like a lot of words and lingo, but really it's kind of a to-do list that any community member can receive and have and just go through check mark after check mark to be able to implement this process and to be able to do it in their specific community. So it lists specific things that the community will do and go through to be able to help them determine what's going on with their own kids, because what's going on in Pleasant Grove with our kids here could be very, very different than what's going on with our kids in Payson, right? And so we need to know what's going on here and what we specifically can do about it. And that CTC helps us do that. You can see a little bit on the results page the differences of what happened in CTC communities versus communities that did not implement anything at all, and you can see some of the results that they've seen there. We also have specific results for our own Utah County. So we have CTCs that have been in progress for up to about 8 years, and we've seen drastic results in youth substance use, youth suicide, family conflict in those specific communities. So specifically, Payson City has implemented CTC for the past 8 years. We have a Communities That Care coalition in Saratoga Springs and Eagle Mountain that have partnered and come together. We have one in Provo that's with the Provo School District that is working and has been up for, I think, about 3 years now. So there are other communities that are going through this process, and we're seeing results, and so that's important for you to know as you're considering going through this process, that there are other communities that have done it that you could reach out and talk to, but also can share specific results on what they've seen in their community as well. So with that, I'm going to turn it back over to Heather, and maybe we can both answer your questions, and she can talk more of the financial bit.
So as it stands, do you have any questions about CTC or about the process so far? Is there anything that I can answer at this point?
Give us an example of what you would do in a community, what your organization would do.
So, for example, the community, the coordinator, so let me just explain how this would work. How it works logistically is the city hires a part-time person who would be called the coordinator, who would run the coalition. The coordinator is going to have a coach who's going to support them through every step that Melissa was talking about. Every step of that process, there's a coach that can help go through that with the coordinator. So that person is a 20-hour-a-week person. They gather community members. They establish the coalition. They also establish a key leader coalition, which is kind of the decision-making branch. And once that is established, then all these community members come together and start to assess the community. What do we have already? What are some barriers? What are some gaps that we have? So they basically figure out what's already in place and what needs to be addressed. We take data from the school. There's a survey that's done every other year in the schools, and that will be released sometime this fall, probably
Is that a
September.
survey done by CTC?
No. It's not by CTC, but they partner.
They give you the results.
We get the results from the company that does it, and then CTC goes hand in hand with those results to look at what needs to be done based on these numbers. So we say we've got a high, say marijuana use is increasing in the youth. Past 30-day use has increased 5%. So maybe we get with the community and we find an after-school program that teaches kids about the dangers of marijuana and also, gives information to the parents about how they can talk to their kids safely and effectively to prevent them from using marijuana. So, that's just an example. It just basically looks at what's going on in the community, what are some resources that we already have, and what are some things that are lacking, and how can we bridge those gaps? Are we seeing high suicide rates? Do we need to, train for mental health awareness? Just different, whatever the issues are. It just depends on what's going on as to what will be implemented.
And how long has this program been in place, the CTC program?
CTC's been around for 30 years.
That long?
Yeah.
Here specifically in Utah County?
No, in Utah, we've been, I want to say 15, well, no.
I think it started in 2003 here in the state of Utah in Tooele. Tooele was actually one of the,
The pilot.
pilot programs. Sorry, I'm like, should I talk in the microphone? Okay.
No, no, really.
Yeah, please.
Yes,
Yeah.
okay.
So they can hear you.
So Tooele was one of the pilot communities that was actually chosen to implement CTC. So there are two communities in Utah, and I can't ever remember the one that they used that did not implement CTC, but Tooele was one of the very, very first. And this program is out of the University of Washington. And so with Tooele coming in from there, the state really got on board with community coalitions, with prevention and how it reduced some of the problems we were seeing with our kids. And so then the state started pushing funding forward, which is kind of ultimately how we have additional funding as well.
So is this nationwide? Mm-hmm. It is a nationwide
Yes.
program?
Internationally,
really?
they even have coalitions right now going on in like Chile and
And do you
other
work at all
places.
with Greg Hudnell from Hope for Utah? Mm-hmm. You do?
Not directly, but we would consider him a resource and a partner.
Okay.
Absolutely.
Okay.
So Heather, talk to us about the part-time position. You talked a little bit about the county would maybe fund that for the first year?
Yes, like I said before, we were able to obtain a grant that would allow for the county to pay for that position for the first year. I don't know how many of you are aware, but it takes some time to, once you establish what your data set is going to be, what your baseline is, to see change. It doesn't happen overnight. It's going to take a couple of years to really see progress and change. So I'm hoping that if I say, let's do it, you'll say yes and support it after the first year. But I can fund it entirely for the first year with the grant funding that we were awarded. And then what it looks like in the following years is a match by the city. And so the county would provide approximately $16,000. That's what's been going out for the other cities right now. And then we ask for a $10,000 match. And so that helps to pay for that position. And there's a little bit of funding for training and, supplies and different things like that. So
then are they based here in Pleasant Grove, and are they a city employee or a county employee?
they would be a city employee, and then the city would be reimbursed. So the city would pay that person their wage, and then send us invoices, and then we would reimburse. So it's a city employee housed by the city, but partners with us. So the training and all of the coaching and everything is provided forever and ever and ever. We want to see it. This is my passion. This is what we're excited about. And so we want to make sure that it's working and that it's effective. And the way to do that is to continue to reach those fidelity factors, and through coaching and sticking to it is how you get there. So we want to provide that and make sure that the coordinator has what they need all the time.
And does a coordinator need to be a mental health professional or not necessarily?
We just contracted with American Fork. They hired someone. She had worked as a pharmacy tech, and she just is really passionate about her community and has kids and wants to help, affect some of these issues. And so, yeah, it doesn't have to be a specific background at all. Just someone who wants to learn and is willing to do the work.
Okay, awesome. Thank you.
Any other questions?
Council, anything? Did you receive any funding from MAG, or where does some of your funding come from?
We have federal block grant dollars, the substance abuse prevention and treatment dollars that are federal. We have, like, one of our grants is called a Partnership for Success grant. It's all federal money. There isn't anything that's the state funding that's paying for any of this right now. It's all federal dollars that we just get ongoing every year to help pay for our prevention folks. And so that's what we're using to keep this going.
Okay. Anything else?
Yeah, good
Well, I guess it'll be a further discussion on another council meeting, and we'll get back with you.
Well, that sounds awesome.
And if we wanted to reach out to these other communities that have this program in place, would we just contact their city manager, or who would be the best person to kind of get feedback about the program?
You could contact the city manager. It depends on what city. If you wanted to like the American Fork Police Chief has been awesome to share information. The Payson mayor was the one who got American Fork on board. So it just kind of depends on who you reach out
Okay.
to and which city. But I'd be happy to give you contact information so that you can find out more.
Do you work with Alpine School District as well?
We work with all the school districts very closely. Yes, absolutely.
Awesome.
So, Scott, with them funding the first year, would this be something that we would need to pass for as the budget, or would we just go ahead and move forward?
No, it wouldn't be a budget issue. I don't know if we have an actual contract or how we do that, but we just have to have an understanding that we'll be funding it moving forward. And if we're talking 20 hours a week, do you know roughly what they pay?
It depends on the city. The AF started at 17 an
Okay.
hour.
So 17 would be probably $18,000 a year or something like that. So, if we pull the trigger on this and we do this, we just have to have the understanding that that's a position we'll need to fund next year.
Well, so the first year it's funded, then the years after that, you said the county would give us matching, right? Half?
Yeah, I've been providing about 16,000 and then asking for 10 from the states, or from the cities, just to make it all work out. So, and it is through a contract. We would have a did I send you a template? of
Yeah, I
what it
think you
would
did,
look like?
actually.
Okay.
Yeah, so,
Okay.
so we enter into an agreement and
But
work through that, so.
It sounds like an amazing resource for communities.
It's
And I
incredible.
didn't know that you'd been around this long.
That's the sad thing.
Yeah.
It's like the really, really good stuff doesn't get promoted as
Yeah.
well as it should by
Yeah.
any means. But we've been around, and the results are showing. I mean, like she was talking about, Tooele was the first pilot program in Utah. They are the only city in the whole state that had numbers go down in suicide ideation this last survey year. So yeah, and it's because of the work that they're doing through the CTC, through the community. I mean, it's just amazing stuff. So we're happy to help. We're happy to make this happen however we can. So
Well, thank you for making us aware. I mean,
absolutely.
I have a question. So, is the office of this employee, is it best near the police, or is it best near the community? Is it best in the rec center? I mean, have there been locations that have been more advantageous for
You know, it really,
community
one,
involvement?
in Eagle Mountain, Saratoga Springs, she's in her house. So it
Okay.
just really depends on what you guys feel
Okay.
would be best.
Okay.
This,
We've had police before. We've had them in the school districts before. Like Heather said, we've had them in homes before, and then we've had them in city offices. So it really just depends. A lot of it is based on room, so where you can find room to put somebody. But other times it's been more specific. But
Okay.
we've seen them work in all those places.
So you'll be presenting, are you going to talk to Linden and Cedar Hills?
I eventually, absolutely, eventually. One of the things that we kind of mentioned was doing a partnership, because where Eagle Mountain and Saratoga Springs partner, then they both provide half of the funding, so they each pitch in 5,000. That might be something that we could talk to Linden about. I don't know if
And
that's something.
Cedar Hills.
Cedar Hills or Linden. How is this different, like a victim's advocate position in the police department?
The victim's advocate's going to be getting really, really into the nitty gritty with individual people and, walking through their case and dealing with the trauma and the aftermath of what happened in the case. And this person it's more community level. So we're looking at a broader scope. We're looking at the data. We're looking at the resources that are available in the community. We're looking at, what are some options that are already available instead of just one person or one caseload. It's the whole community and all the kids in the community, and it's not tied to specific cases or incidents.
Okay.
It's substance use as a whole, or depression as a whole, or lack of commitment to school as a whole. So it's just more broad.
Yeah.
Okay, thank you.
Thank you so much. Thanks a
Okay.
bunch.
So what would our next step be if we? Is it just to what?
What's
The what and when?
Yeah.
Well, that's
Now
what I'm
what?
saying, because it's not much of a budget item, because the first year's funded, the next year it's more than a match, right? I mean, you guys are
You
giving
have
us,
to put it in the budget because it's
Yeah.
a new position.
yeah,
For next
Probably
year.
not this year because it's not a funding issue,
Correct,
but
yeah.
next year we'd need to make sure it was in the budget
yeah,
because we don't have that position or any funding.
Correct.
This year.
So would we just bring this back to a regular council meeting discussion item and see if that's something we want to vote on moving forward?
One more question. Is there a population number so for example, if we were going to talk to Linden, if we were going to talk to Cedar Hills, is one person able to do, what is the population?
We
Ten.
haven't done
By population?
population at all. It's been pretty much based on city.
well,
Okay.
you've got one in Provo, right? A part-time person in Provo?
There's a person that covers all of Provo.
Yeah, so,
Okay.
So if we did get Cedar Hills and Linden,
We could,
Honestly, I almost feel like because all of the areas are growing so much, that it would be smarter to keep them separate. Just so
Okay.
that you can focus really on the specific, and that's just my personal opinion, but I just really feel like with the growth that's happening, it's better to just focus right on the most information for that specific area.
yeah.
Do you know what I mean?
okay, thank you.
Okay, thank you.
Thank you.
Okay, we'll move on to our next item this evening, and Scott's going to introduce this to us on recycling our rubbish. One of our favorite topics.
I just need to update you. We have a little problem out at the swim pool right now that's causing some concern. So if it's okay, if we can maybe end the work session, and I'll talk with Reese and we'll figure out how to do that, but I want to make sure the council's updated on what's happening there.
Okay, that'll be all right, Reese? So,
Rubbish.
so so I'll move that we adjourn from our work session.
so moved.
All those in favor, say aye.
Aye.
Okay, we had,
A second. I'll second.
yeah, that's good, we did. Thank you for catching that. And we had an aye for all that, so we are adjourned now, so we'll wait for Scott to come back and we'll adjourn into our conference room. And so we'll be back at about 5:02 in here, so